Good morning, everyone. We officially begin with today's workshop of the day. It's really going to be a very great learning workshop, healing the traumas and phobia through yoga and naturopathy approach. Today, we have with us one of the very eminent, very balanced, very composed doctor with us, Dr. Sreedhar, who is CMO of Prakriti Shakti, which is a leading naturopathy and a yoga hospital and a clinic. He is a very eminent physician with 17 years of diverse experience. Especially his healing experience is really very good. He has delivered powerful sessions throughout the world and serves through key matters like Ayush matters and he's also helping to shape up the BNYS education and standards. So he is one of the very important personality in the field of naturopathy and yoga. Recently, he has published a book known as Naturally: Your Journey to Good Health. He is known for his clean, inspiring approach to natural healing. So, a truly impactful speaker for today's workshop on the topic healing traumas and phobias through naturopathy and yoga approach. With that, I welcome Dr. Cijith on this platform and request him to start with his session and enlighten us with your knowledge. Thank you so much.
Thank you, Dr. Vivek Bhartiya, for your fantastic effort of organizing CMEs on a continuous thing. I know it's not a small thing. Um, and then for the nice words about me too. But that's secondary, like your effort of a continuous, I know you are dedicated on every Sundays to do this. It is not something easy. So that shows your, and I know even before that, your effort to do it, like when I remember about you, the effort of Enigma Directory, I remember the words of Swami Vivekananda. You take an idea, work big in it, make it big, never stop. So I remember whenever I saw any update on Enigma Directory, I remember that words of Swami Vivekananda. You have something really practicing it. I know in our naturopathy community, when we stand for something, you cannot expect help from on that. From my dream is not everyone's dream. My dream is only my dream.
I do understand. Thank you so much for your work.
So this is a dream which you can make it work only with other people's contribution. You can alone never can do that. If it's writing a letter, meeting a minister is easy. If I have a connection, I can do that. But making a database, you need our effort, and by taking a 2-3 minutes to enter a data sheet, we know how people are willing. So your effort is so marvelous, and that's showing so much result. So I like
Thank
to congratulate you and thank you for that. Then thank you for inviting me to this program. Okay, let's start. I know there are around above 100 registration, but we are only 26 people now to start with, but we will start now. Any such healing workshops should be always interactive. So I know we cannot make a complete program on this by a 1 hour session. Yesterday I do the same topic. I did the same topic on with the Kerala Enigma. It was 1 hour workshop. Tomorrow I am doing with SRKMC College in Kanyakumari, again a 1 day workshop. So I cannot replicate the same thing in a 1 hour, but I can just give a basic idea. So a different approach or something, a big tool which we can incorporate into our practice. Obviously, which goes well with us because it is drugless and it really work on our concept of addressing the root cause. So I request all of you to give a feedback in the comment box now. Like when a patient come and tell you that a diabetic patient, a hypertensive patient, or an anxious patient, or an OCD patient uh, come and tell you that I have a diabetes, or I have anxiety, have OCD, have phobia, what will be, as a doctor, what will be your immediate next question you ask to them? You can either unmute and tell, and I don't expect many people will respond to that, but at least respond in the comment box. Like, what will be, as a doctor, as a yoga naturopathy physician, and a person, I am repeating the question, but you can start commenting in the chat box. It is very important. I cannot go forward without this answer. What's your response immediately when a patient come and say, I'm diabetic or I'm anxious? Since when? Right. From how long you have been feeling, and how are you feeling now? Okay. Anything else? We have 26 doctors. Is every 24 others are asking the same question, or something different you ask? HbA1c. Okay. If a person come and say, I'm anxious, what are the behavior patterns? Exactly. Good. So these are things we ask. Anything else? I ask, the question answer is not complete. I think that was from Dr. Jinsey. And I'm anxiously waiting for her answer, because he was one person is expert in mind healing. I asked their entire history. Okay, so by asking since how long and how do you feel, what we are doing. When a person come and say, I am diabetic, I am hypertensive, I am anxious, and when we ask since how long, what we are doing? We are subconsciously reinforcing their belief. We are not questioning their belief. So, I have a real example in this. One patient came and told me that I am anxious. So I asked him, since how long? Same thing we mentioned. Then he said, I'm anxious, have this problem since around 7 years. Then I asked, what you did? What is the history? I met 4 doctors with this. Then I asked, why you went for 4 doctors? Why you went to the last doctor? What he did? He gave me some technique to do. Then why you went for the 3rd doctor? Because the 2nd doctor thought that I have anxiety, and they gave me some medicines. That didn't work. Then why didn't the 1st doctor? I went to 1st doctor because I had anxiety. Then who told you that you have anxiety? That I had some problems in my house. My heartbeat was high. I was restless. I googled it. Then I understood I have anxiety. I went to the doctor and said I have anxiety. Really, in this case, did anyone did a diagnosis whether he had diagnosed anxiety? When he came to the 5th doctor, to me, when I asked since how long, what I'm doing, I'm not questioning his belief. Instead, what as a naturopathy yoga physicians who claim that we treat the root cause, we must have asked, what do you mean by anxiety? Then I can know that the patient will give us a puzzled look. This idiot don't know what anxiety means. Yes, we should ask him, anxiety, what is that? Then he will say, I have sometimes when issues comes, my heartbeats goes up, I get restless, I get puzzled. Then we should ask, is that what anxiety means? Then the next question comes isn't it anxiety? I don't know. By we questioning that belief, we can really unfold or unravel the basic symptoms or the basic experience of that people. So when we ask what does anxiety, when we don't address the word anxiety, and when we ask them what does it really means, when they say I have palpitations, and then we should ask them, if we help you to not feel the palpitation, then do you have anxiety? Then they may say, yes, if my heart rate is not responding to a stimulant, then he's no more anxious. So what we should address? So we should look into the physiological response, the physical response of people to any stimulant. And the same way, we should also question the identities of the people which they carry with them. When a person comes, say that I am diabetic, I am hypertensive, I am anxious, what they are communicating with us, or I am obese, what they are communicating with us, they are identified themselves as the disease. What should be the better question? How we can rephrase that statement? How we can make them to rephrase that question? Instead of I am diabetic, what should be the ideal way of saying that? Can you give in the comment box? There are people come and say that I have high blood sugar. Oh, I have diabetes. We can say that. Or I have said I have uh, I have so my report says that I am diabetic. Again, it is I am coming there. Instead of saying I am diabetic, if we can make a person to say I have a diabetes, or I have high blood pressure, or have an inability to handle stressful situations, then we change the identities of people. And when come to these phobias and trauma healing specifically, when people come and say I have a phobia of heights, first we should ask what does that really means. We should ask them to define each words of their statement. What does you mean by height? Is it 5 steps above? Or is it in the first floor in the balcony of the house? Or is it in standing in the top of a hill and looking down? Or is it standing in the top of a mountain and looking down? Or you go to a bungee jump and you cannot look down? It's all different. So instead of immediately asking what does that, or since how long, what is the problem, we should ask the people to define these statement they make. We should not initially 100% goes agreeing with the statement they make. Then we should work on their mind. Now I will ask you to everyone to look around the house or room you're sitting now for 30 seconds and identify the red color in your room. For next 30 seconds, just identify the red colors you can see in your room. Identified? Now all of you can close your eyes and list out the blue things you see. I don't know how many have followed my order, but those who did, just close your eyes and list out the blue things in the room. Difficult, right? That's the same thing happens in our life. We see what we focus on. So when people come with phobias and traumas, that same thing happened to them. They always see what they look for. So it is important to change their perception. This perception of seeing what we look for is known as reticular activating system. It's done by the system in the body known as reticular activating system, which makes our perception. So it is very important that it is our perception. And we might also experience the same thing by when we look for, imagine when you look for a very unique, specific branded car. And when you come out, we can see that car, same color car everywhere. Or if you wear a very specific design of customized dress, and when you go to your party, you can see that many people wearing the same kind of thing. Isn't like that when you decide everyone did the same thing? No, that is what frequency illusion. So this should be identified and communicate the people who come with traumas and phobias. These frequency illusions, which we all have, is programmed by our experiences, our memories, our stories we heard, the social roles we play, and the focus we give to things. All these together makes our subjective realities. This subjective reality is not comes directly with like that. It is superimposed by three factors: deletion, distortion, and generalization. I can say a clinical example I had. A mother and daughter came to my hospital. They were stressed. The problem was the mother was running running a family business, a branded hospitality brand in Chennai. And this daughter completed the graduation on hospitality from UK. 1 year she worked in a famous brand in UK and earned the best employee award there. Then family asked her to come back and join the family business. She came back to India, but she told her mother, so she was a single parent, that I'm not interested to take the family business. I want to teach English for primary school. There was complete mess there, because there's a single daughter and no one else to take care of the business, and she was actually qualified and skillful in that. No one able to figure out what is the problem. Even the daughter was not able to figure out the problem. And then when came to us, I was starting working with the daughter. She was said that I studied, I learned English. Now I want to make sure that the new Indian kids can get better communication. I love to interact with the kids. All these things they said in the first 2 days. When we go deep, she told that I love my mother, so I don't want to get into family business. Then I asked, what from where that is coming from? Then she told that her experience of going to break, as she was a school kid, going to her grandfather's house, who was then taking care of the business, every day morning in the breakfast time. So they used to have breakfast together, and on the breakfast table, her mother and grandfather used to discuss and fight or argue regarding the business attitudes and business approaches. She said that if I take the business, I may also have to fight with my mother, so I don't have to. What might be the next step we will take in that? Can you comment in the comment box? If a person say this, what we should ask next? If this is come to your clinic, you're working on a patient coming with stress, she said this as the answer, what will be your next question? No one dealt similar situations? They should not bring business stuff to home. Okay. Then again, we agreed her statement. Your past doesn't define your present. By this, all we are agreeing with her past. I ask her, on average, how many days in a week you used to go to your grandfather's house for breakfast? She said almost 7 days in a week. That means 365 365 days in a year, they are having breakfast together. Then I asked her whether they used to fight every 7 days in the breakfast table. She said, no, not every day. I said, 5 days in a week? Oh, not even 5 days in a week. Maybe 2 days in a week they used to argue and fight. Then I put the statistics in front of her. So 2 days in a week means 54 days, 54 weeks in a year, and 2 days in a week means around 110 days in a year. So out of 365 days, they used to fight only for, even if she agree with the statement, only for 110 days. What about remaining around 250 days? The 250 days was deleted, and the 100 days was generalized as her complete childhood experience of breakfast. And a fact was distorted that running family business is fighting with parents was never a reality. This was created as a subjective reality for her by this reticular activating system or frequency of illusion. This is one aspect of it. I'll ask you another scenario. Do you have been any classmates which have a physical speciality or a deformity? Someone like a sixth finger, or who have some speciality in the face or in the hand? You might have had, right? In your first standard, second standard, or a primary school. And now, when you see anyone of similar deformity or similar speciality, what you will remember? What the first thing comes in your mind? Your classmate in the first class or second class, right? Isn't it? You might have seen many people in life later with similar deformity or similar speciality, but we don't remember them. We remember our first memory. So that is a usual pattern. So here in her case, same thing happens. Whenever we have any experience in our life, every moment this is happening. This reference to the first memory of experience. Other than in cases associated with strong traumas, especially in case of physical abuses, every cases we go for our first memory or first experience. This happens by the involvement of two brain centers, hippocampus and amygdala. Imagine a patient is sitting outside your consultation room and consultation is happening. Now, just when the patient saw you in your sitting in the consultation room before he comes in, now what her brain or his brain will do? They will take a picture of you, send to her hippocampus and ask, did I seen this person earlier? Your hippocampus may say, you didn't see the same person earlier, but you might have seen a similar person and give the image. With that image, her brain will go to her amygdala and ask, what was the experience or emotion? Amygdala said, was not nice. You are cheated by that person, or that person misbehaved with you. So the patient will come to your room with a subjective reality that I should be conscious. We have no role in that. It is a subjective reality is made that way. So it will be very difficult for us to convince that patient to trust us in that case. Even not even knowing such things are happening in subconscious mind. It's not only with patient, this happens with us too. The subjective realities made with the filter of generalization, deletion, and distortion. This was beautifully explained in yoga as chittavrittis. So what is yoga? Yoga chittavritti nirodha. We all learned that. Yoga help you to stop the chittavrittis. Chitta is the aspect of mind where this reticular activating system works and of which the subjective realities are made. So chitta vrittis, when yoga help you to stop this chitta vrittis, that is why the next shloka it says tade dishtu swarupa avastha, and we can see the swarupa, the reality. Yoga help you to take out the chitta vrittis. And again, it beautifully explains how this, what are the types of subjective realities. Pramana, Vibhiriya, Vikalpa, Nidra and Smriti. What is Pramana? What is Pramana? What is the English meaning for Pramana? Can someone give in the chat box? Right knowledge. Nidra is sleep, right? Memory, Smriti is memory. Did you, in your school, when you learned this, do you ever thought in your college that how a right knowledge, sleep, or memory should be stopped? That means what? When you practice yoga, nidra will be nirodha. You don't get sleep. You get end up in insomnia. When you do practice yoga, smriti will be erased. You end up in having Alzheimer's. When you practice yoga, pramana will be stopped. The right knowledge will go. And you will become an idiot. Isn't it? Is it like that? Do you ever thought it that way? Did you ever questioned that statement? That's not the real meaning of that. Pramana, right knowledge is not the problem. It is not right knowledge. Pramana again, so that is why Pramana got again explanation there. Pratyaksha, Anumana, Agamana Pramanani. Pratyaksha, that what we see. Sun rises in the east. Is it right or wrong? Please comment. Sun rises in the east. Right or wrong? You might be asking why I am asking this to comment, right? Right. So they also said sun rises in the east is right. They should agree with, oh, one person said it is wrong. Oh, then there is a problem there. Should agree with me that earth is flat. If sun rises in the east, earth is flat. Both are our pratyaksha. We see it directly, a flat earth, and sun rises in the east. But that is our subjective reality, a perception. If we go to other planet, it may happen opposite. Pratyaksha is something created by our mind. Reality is local. Then from pratyaksha, anumana, agamanani, pramanani. Anumana is the guess. What we guess. We guess and say think that that is right. And the most dangerous subjective reality is agamana. What we say that who's come from the authorities, which cause act as one of the basic problem where the world faces. The religious text, agamana, and every believer have a subjective reality that their belief is right and this is the best, and they kill each other. It is because of the pratyaksha, anumana, agamana, the pramana, the subjective reality they make. There comes everything like that. Pramana, Vibhiriya, Shabda Jnana Anupaste, the subjective reality is made based on sound. No, the Vibhiriya is Pramana, Vibhiriya, Vikalpa, Vastu Shunyo Vikalpa. Okay. So these are subjective realities made based on our wrong perceptions, sound waste. Then comes Nidra. What is Nidra? How Nidra can be a subjective reality? Nidra cannot be directly translated as sleep. Nidra is a baseless state. Usually politicians used to say, which is called baseless allegations. or the baseless feelings we have. Most of the phobias are rooted in these baseless feelings. Why one should have a fear of lizard? Any reason to have a fear of lizard? Anyone here with a fear of a lizard or a cockroach? Anyone here? No one. That is never possible. When there are 36 people now attending, there will be minimum 3 people with a fear of lizard or a cockroach. That is a statistic says. So why we should have a fear of a cockroach or a lizard? Is there spider? It's okay. Can fear of spider, lizard. For a person who have a fear of lizard, do you ever read any information, any data all over the world that a person died out of a lizard poison or a lizard bite? Or a lizard killed a person? The house lizards? No. Then why you have that for fear? That is nidra, baseless. Isn't it? Abhava pratyayana alambana vrittirnidraha. This is a vritti, mental modification out of pratyaya. There is no fact figures which supports this. There is no data. There is no reason to support that. And finally, smriti, the memory. I already narrated a story how a memory of the lady who had the breakfast problem with her grandfather created a subjective reality that running family business is fighting with the parents. So these are the chitta vrittis, the subjective realities. See how beautifully thousands of years back this the problem which one of the root problem which people face is said that, and yoga is of the tools to overcome this, to overcome the subjective realities. How? By dhyana and pradiprasava, by mindfulness and going to the roots, going inward, which I did with her, going and analyzing from where it is originated and root, and understanding the reality of it. This helps you to unwrap the basic fears and phobias of people. When these subjective realities are formed out of these, all the networks I said, which end up in a resourceful or unresourceful belief. That is why, again, Yoga Patanjali says it can be klishta or aklishta. It is not painful or non-painful. It is favorable or unfavorable. So subjective realities we make sometimes can be favorable, sometimes it can be unfavorable. If it is favorable, that end up in constructive actions. If it is unfavorable, it leads in destructive actions. Or the word I use is resourceful or unresourceful. If subjective realities are resourceful, you can make it better. If subjective realities are unresourceful, you have to destroy it. You have to get rid of it. That should be our role as a holistic physician. We should not agree with what they say, our patients say. We should look into as a subjective realities. These subjective realities can apply in all the conditions they come to us, including physical diseases like diabetes or hypertension. There are persons you might have experienced, I have seen, who people say that they are diabetic for many years and taking even insulin, or the people say that are hypertensive for many years and taking medicine regularly. They may not have hypertension or diabetes. It is they just made a subjective reality. Some doctors reinforce it. They are taking medicine. Had a doctor from Tirunelveli, one of the famous gastrologists there, who taking insulin regularly, but his diabetes was a subjective reality. Actually, he was not diabetes. Sometime when he was going to stress, his sugar gone up. He went to one of his friend. They suggested better go to insulin, and he started it. It was a subjective reality, not a reality. And obesity. We have seen many times people come to us. Their BMI is in normal range, but they come to us that I have obesity. I want to reduce my weight. We may see from where we'll get them to get rid of the weight which they don't have. So we have to work on the subjective reality in that case. Then comes, if these conditions like diabetes, hypertension, or obesity can be a subjective reality, what about the topic which we have today, a phobias or a trauma? Phobias are not fear. Phobias are baseless fears. So when we treat the phobias, we should identify the subjective realities of that and the memory or experience connected with that. This is the first aspect of it. And the second aspect is identifying the physical response to it. So healing a phobia have these two aspects. One, identifying the memory associated with or experience associated with it. Two, identifying the physical response of it. I will make it very clear. Identifying the memory. A person have a lizard fear will have some memories or experience rooted for that. In many of the cases, we can see something which is consciously they know. Sometimes it will be in the unconscious mind. And the spiritual practices say, in few cases, it can be even rooted in the past life, which we are topic of discussion today. Let's discuss only of present life. So I had a patient who had a lizard fear, not only lizard fear, she had a fear of all the insects. She will get freeze when she see any insects around her. When I start working with her, her experience, the reason for it started was a lizard. She was from Bengal. Those who from Bengal may know that there's a very big lizards in that area. Had fallen from the roof on her nude body on her first night. And from there, he started having these phobias of anything which crowd. So every phobia will have a subconscious or a conscious memory. First, we need to able to identify the person. I had a case where a person had a fear of going to beaches. Interestingly, her husband was a sailor and she traveled with her husband all over the oceans, all over the world, globally. She had not a problem in traveling ocean, but she cannot go to beaches. When I started working on her mind from where it started, in a very young age of 1.5 years, which you may not remember who were and what we are, she went to a beach with her parents, and both parents were holding her hands, and suddenly a wave come and covered them. Luckily, she was handled by parents two sides. The wave didn't take her, but took her, but she was still have the traumatic memory of that waves. She don't remember that incident on initial discussions. But when we go deep in the mind of layers from during a timeline therapy or timeline analysis, this memory came up, which was not remembering. And she was even able to remember the dress she wore on that day. Now the question comes, I know two questions comes. One, whether a 1.5-year-old child can remember that. Two, it can be real, whether it can be her imagination. First, it can be all memories we can store in our cellular memories. It can come up in our subconscious mind. Second, as a healer, when we treat such condition, never question these memories or experience shared by our patients. It can be real, it can be unreal. Even it can be her dream. We don't know. But for her, that act as a root reason for her phobia. And we should accept that and heal that. If it is a traumatic experience, something like a lizard or the whale, we should use the technique of inner child healing. If it is something associated with a memory, we have to use the technique known as disassociation. In both cases, physical desensitization also uses. So I'm reaching the techniques we into that. The first thing is first I go to physical desensitization. So for every traumas and phobias, there is a physical response associated. If you are a person like that, you can do it now. You can just close your eyes and bring a memory where you have recent experience of such traumas or such stimulant. Experience as if it is happening now and scan your body and see which part of your body respond to it. You may feel sometimes a butterflies in the stomach or a tightness in the chest or something in your throat or your hands or in your jaws. Every traumas, every such negative experiences or even a positive experience have a physical association. That is why usually people say when they are in love, then when they meet the person in love, especially in first love at first sight, they feel butterflies in the stomach. Or we have seen that when people have stressful incident like going to write to exam, people get stomach cramps because every emotion have a physical association. So to get rid of that, the first and easiest way is physical desensitization. You have to make the person to imaginarily going through that experience without involvement of the body part. Those who had identified the physical part now can again close your eyes, bring the trigger again within your threatening circumferences, feel the presence of that stimulant. If you have a lizard, imagine that a lizard is there in front of you. If you have fear of height, imagine that going a height. If you have fear of dog, imagine that a dog is near to you. But focus on a physical body, not on the stimulant. And make sure that the physical part is remaining normal. If it crumbles in the stomach or is a heaviness in the stomach, make the stomach lighten. Is a heaviness in the chest, bring the lightness to the chest. If a tightness in the jaw, relax the jaw. Make sure that your physical body is not responding to the stimulant. You may run away from the lizard or you may stay with the lizard. That is different. That decision you will take consciously. Make sure that your physical body is not responding to the stimulant. Let your conscious brain, logical brain take a decision there, not the body. By dissociating this kind of response of the body, the first step of healing phobias, traumas, and healing addictions. This can be successfully used in making the person especially quitting smoking. Because for even in smoking cases, there is a physical stimulation, there is a physical communication of the body, which is a different methodology we do, but I just mentioned it here. After doing the physical desensitization, we can go for another step. Next step is disassociation. Making the person, if there is a root memory, which remember as the first memory, as I said about the sixth finger of your classmate, the first memory they remember. It may not be the first experience or first memory they had. The first memory they remember. Bring again in front of them by the closed eyes. We can make them into a meditative state or a relaxed state. Then do the technique of desensitization, where removing the color, removing the volume, reducing the size, making it dark, reducing the brightness, and deleting the memory forever. This is a methodology we can do. I can demonstrate if someone come out as a subject now. Even online I can do that. If not, I can show only the steps. This disassociation will help to remove the memory forever. We have seen that certain healers or counselors will make the person to write the trauma or the first negative experience, which usually backfires. Don't make people to write negative experiences. Writing is a neurogenerative program. Writing makes sure that it stays longer. There are people who ask them to write a negative memory or a negative experience and burn it. The problem here is writing is more neurogenerative than a visual of burning. So the trauma may not go with that. Don't make people to rewrite or even re-visualize or re-narrate, not re-visualize, narrate their trauma events. That is again conventional psychologists. What they do is they ask person to narrate what happened, especially people, the ladies who go into physical abuse. We don't have to ask them to narrate it again and again. Every time they narrate, the nerve system gets stronger. Disassociation they can do by visualization without narrating the trauma to us. It have two benefits. One, the client or subject is not narrating the negative experience, and for us personally, we don't have to listen to all the negative traumas and experience of patient again and again. If you are a person who did this as a specialty and meeting 15% in a day, your day is gone listening to all the negative stories. We can do this even without listening to the stories. Whatever the story, it is almost same. A traumatic or a negative experience which they have a subjective reality. Just change it. And the third methodology we have to do is inner child healing. So difference in these application, the physical desensitization will work in all the cases, but disassociation work in specific memories, specific strong memories. But if it is a long-term issue, like a troublesome childhood or a troubled marriage or a separation from parents going to boarding school, if it is a long-term memory, long-term experience without specific incidents, inner child healing is better way of doing it. And when come to inner child healing, the most strong healer is a wise adult. Every one of us, every person come to us have three personalities in us. It is not a ego, super-ego, which I am saying. The three personalities, three egos we have in us is a child ego, an adult ego, and a parent ego. Even if you are not a parent, you have a parent ego. This child ego, the child personality have two aspects. One, a natural child or an adaptive child. The natural child is the one usually explores, take risk, do mischievous things, get scolding from the parents or from the teachers. The adaptive child is the one, the behavior is adapted to get the good book entries, to be the good boy or a good girl. Sometimes develop the habit of telling lies to adapt with the situation they live. A natural child will develop as a nurturing parent. An adaptive child may develop as a critic parent, and the cycle continues. A critic parent again make an adaptive child. Okay, that is not the part we are dealing it now. In these three egos or three personalities, an inner child healer, in the session of inner child healing, we must use the wise adult of that person. Everyone have a wise adult. When we come to, for example, if we're treating a phobias or a trauma, in traumas, mostly the memory healing will work. In phobias, there may be repeated incidents are there, or in a separation case, that this even in if separating from parents to boarding school is a trauma. In such case, inner child healing works. We have to make the wise adult to heal the inner child. What is a wise adult? A wise adult who knows that a lizard, no one die with a lizard bite, or a lizard never bite a human. There is no much diseases which caused by a cockroach. Houseflies or mosquitoes make more diseases. Or separating from parents in childhood is no more relevant now. I have a family, I have a friends. I am good for enough for myself. These are the adult wise person knows. So to use inner child healing, we must use the statement, the rational, logical statement from the wise adult, which is complete, which is backed with data and figures. If yesterday when I was doing a session with Kerala Enigma, a person told that I have financial insecurity. Why? Because she had experienced financial problems in the childhood. But that is no more a reality now. She are good, capable, enough, successful doctor who can make her own money. Even if she don't have a bank balance today, if she spend that money today, tomorrow she can make it again from her practice. That is a wise adult who knows. But the person with financial insecurity is the inner adaptive child who compromised inner needs to meet up with the financial problems of the parent or in the childhood. So in such cases, an adult wise should go and meet the inner child. Without, that's a session we have to do, which have around again 5 steps. One, making the factual, logical statement by the wise adult. Then meeting the troublesome child. So we have to ask the client to ask what age they had the traumatic experience, or a age period between 3 and 5, or between 5 and 10, or between 10 and 12. Anything which from yesterday is your child. So anything which happened beyond your yesterday can be your inner child. So we have to meet that person. The adult wise meeting the inner child in a very safe, secure, friendly environment. And first step in that is listening, non-judgmental listening. We have to make a person to a semi-hypnotic state, in a relaxed mindset state, and make sure and may ask the adult wise to go and sit near to the troubled inner child. And we know that we may have the same experience. The first complaint of many people who have gone through that traumatic, negative, unresourceful experiences are that no one listened to me, no one heard me. So make this wise adult go sit near to the child and make her to listen. The adult wise, the you should listen to the inner child very in a non-judgmental way, giving enough time. After listening to that, after listening to every aspect of her experience, problem, memory, perception, belief, and thoughts, the adult ways can communicate and convince the current scenario. And the root is the basic communication is that I accept your experience and memory, but that is no more relevant. We have to remove the generalization, deletion, distortion, and find the fact. Then we have to go for this presentation. You have to convince the child that that is no more relevant. You are in a better space, or you are empowered to handle that in a better way. Still you have a financial problem, but I have enough skill to make it. Then handle the child to come to the present reality and show the reality. This is a semi-hypnotic program which we can do. We can easily do the in a form of Yoga Nidra way. The Yoga Nidra is a semi-hypnotic methodology we do. Make a person to do Yoga Nidra and give these instructions and make the person to come find the reality, the present reality. So these kind of physical desensitization, disassociation of the memory, and inner child healing are the powerful tools which we can use to help a person to overcome phobias, traumas, and addictions, and limiting unresourceful beliefs and patterns. To close up the session, let me say that all these works if this is a subjective reality or a subjective perception. If that is a real problem, this don't work. That means if they have a real financial insecurity now, it don't work. If they have to pay a 30,000 EMA tomorrow in the bank loan, working on the inner child don't work, going to office and work or business only will work. If they have a fear, a real fear of a physical abuse from the husband, and still the marital relationship is active, this don't work. If it is a past, it will work. So these are the methodologies which we can easily incorporate into our daily regular practices to help a person to heal the mind. Without mind, body cannot heal. And these kind of memories, experiences, perceptions will directly manifest as physical problems. I can share any number of stories where these negative experience, memories, and perception manifest as physical disease like urinary incontinence, diabetes, hypertension, constipation, many much conditions like that, gastritis, asthma, infertility, multiple cases. So it is 11. I'm just give the brief of it. These all the I am just give a new idea or a new perceptions. Or first, okay, I'll just wrap it up like what I said. First, I did this a clean language method, not agreeing with the patient belief, then looking for the root memory and healing the memory. These are the 3 steps I explained today, and this won't help you by listening to the class. This should be handled and practiced directly. So yesterday in Kerala Inima, we had a session of around 20-25 people attended, and we do it as a workshop. This kind of workshop is required, but I just open a new thought process which we can incorporate to our daily practices. And thank you, Dr. Vivek, for arranging this session.
Thank you so much, Dr. Sujit. Immediately we have a question. Sir, is there any regular class you conduct?
I attend it. Whenever someone invite for me a summary or a workshop, I go and do it. I don't do it as a fellowship so far now. Actually, yesterday after the Kerala Enigma session, there are a lot of demand that one session is not enough. We need regular handholding for that. After evening, I spoke with the Dr. Pradeep he is the expert in running fellowships. I spoke to him. If something works out, I will let you know.
I think yes, you should actually start fellowship. The depth of knowledge you have, the way you speak is actually mesmerizing. The way you speak is as if I felt you had captured our minds and you were exactly telling whatever is required for us. The way you explained was something extraordinary. Matlab, I don't find such a compact and a dynamic topic to be explained in such a meaningful way, the way you were doing it. It's really something awesome. I really hats off to your knowledge and the way you speak. You are an extraordinary speaker, I feel.
Thank you.
So we invite question and answers. If students or the doctors present have their questions, please go ahead. He will be the right person to answer whatever questions you have. Or if you want to connect with him, you can have his email, or if sir is convenient, if he can share his mobile number, then you can connect with him. And
I'll share my mobile number in the chat box. You can reach me in WhatsApp.
yes,
If anyone individually need some individual sessions or need help to some patient cases, you can reach out to me.
yes, this is very essential thing. I think we are dealing with lots of patients, and those patients, the major root cause lies down in their emotional traumas and basically the phobias. What you were explaining was absolutely right, each and everything, and the way we have to deal with them. One thing I liked what you explained, that never make them repeat or write those things because that's going to be again prominent in their memory. So
That is because writing. Do you ever notice that we don't have a center in our brain for writing?
yes,
There is no brain center for writing. Writing is a very complex neurodynamic mechanism. It is not governed by a center. Writing is a combination of two centers, linguistic and artistic center. writing is actually a drawing
Yes.
of the languages you know. So writing is a very powerful tool for positive reinforcement of a habit. Writing brings clarity, but we don't have to bring clarity in something we have to destroy. We have to remove the clarity in the negative experiences. So bring clarity in a developing a positive behavior they want, but not in the negative unresourceful memory they have. So that should be, that is, don't do that. And even not housing repeat.
Sir, I have a question, sir.
Yes.
If we have a negative experience, if I write it down, then I'll become a little more relaxed. Is it? How can you relate it, sir?
When you write it, you feel relaxed for a while, but the root cause won't go from there. The memory is getting reinforced. You may feel relaxed as like you share with someone. Sharing, don't reduce it. Sharing means again half is remaining with you. After writing, it won't go. You may feel relaxed, but we are speaking about healing. It is going forever. And someone asks, is NLP is part of psychology? NLP is a psychological method, but if in a conventional psychology they work on the nerves, but in NLP work on the perception. It's something like the software and hardware. NLP is a software methodology of it, working the perception. But if a person, people have real neurological issues, NLP is not helpful because the NLP work only with people who can have logical, rational, thoughtful brain.
The question was written by me only, sir. I'm Dr.
Yeah.
Megha.
Can it remove childhood from a teenager? Yes, it can. If it is not presently active, if the trigger and scenario situation is now there, we cannot. But if yes, we can. Number of sessions required may depends from 3 to 7, but we can remove that trauma if it is the reality is not right now present.
Okay, sir. And the writing part, that was also first, like for the first time I'm hearing that. It's a different kind of approach. Like whatever we write, it will stay there itself. It is a new knowledge for me, sir. Thank you.
That's why our parents asked me to write and study.
Okay.
Writing will stay in the memory. If you're a parent, you'll tell your kids that you go write and learn. Write and learn, because writing will make a memory to stay, which we don't want to a negative or a unresourceful experience.
Okay, sir. Okay.
Sir, we have a note from Dr. Toshit Badal. Firstly, congratulations, sir, for your book. Sir, I had a doubt of some doctors using salt after a session to remove negativity. Is it practical? Because I have seen a lot of people doing this.
The using salt to remove negativity, one, it is part of energy healing, which I am not an expert. It is part of Reiki and other conditions. Again, using salt, if in an NLP method, using salt to negativity is an anchoring method. We give them, it's like we might have learned the Pavlov's experiment, the bell and the dog. Using salt is something like anchoring, where people have a visualization that negativity is gone. That way it works. But on an energy way, I'm not saying yes or no, but I'm not, because I'm not expert in that. But anchoring is another methodology in NLP, which can be used very effectively to make a person to come out of their habits, patterns, and behaviors.
We have a comment. Great session, sir. Thank you. And we have a question from Dr. Rashmi Bilkiji. Can we completely remove childhood trauma from a teenager?
I replied to that. I said that yes, we can, but number of sessions required is different. We have to work on it, and I said that's why I replied. If the situation, the stimulant, the circumstance is still persisting, we cannot. If that situation is not there, we can remove the trauma. Then someone again asked to remove in the trauma in a simple way. There is no simple way. There is only straight way, which I explained. Like inner child healing, physical decency. There are different NLP techniques, which I cannot say which one works for which is the individual consultation. Then we look into the healing part of it.
For what possible conditions we can use this rather than fears or insecurities?
So what
And
is that?
the question by Dr. Anubhuti, how can we reprogram the patient mindset who is lacking motivation in life?
Okay, before that, the possible we can use rather than fears and insecurities. It can use in all the psychological cases: guilt, frustration, resentment, anxiety, addictions, patterns, it all things, procrastination, identity clashes. So actually, I didn't get to the root of it. The real work is working on identity, beliefs, memories, and value system. That is the real way of working. I didn't get, because that is itself a topic which yesterday I start from 10 o'clock until 12:30. That explanation goes, which I didn't get into that. That is the root of it. So there are almost all the I said, even in a physical condition we can use. Many physical conditions we may have to use this to identify the mind cause of it. And second, how can a person who lack motivation in life? Okay, let me ask you, Dr. Anubhuti, what do you mean by motivation? Dr. Anubhuti?
Dr. Anubhuti, can unmute yourself or write down in chat.
Yes, sir. Sir, any drive to do something in life, any drive, like a motivational drive, basically.
Means that person don't have motivation to do anything in life, or some things in life.
So some things in the life.
Okay, that means that person don't know to do motivation. It's not I don't like motivation in life. He have the lack of motivation to do something in life,
Yes,
isn't
sir.
it? So let's remove life is God. He need motivation to do something.
Yes, sir.
So 80% of the problem is solved.
Yes, sir.
Okay, now what is that something? Is it something which he likes? Something which he don't like? Something he like but he don't have resources? Something he like which but he don't have the support? Something is like but he don't have conviction that it would help him? What is that something?
So he have the basic all the skills, but he is not using his resources well for his in his career basically. So he's simply sitting at home actually, and he's a medical coder or something. He's doing that work, but he's not functioning properly with it.
Okay, that means he is. So now, for any patient who come to us, what we are doing? We are helping him to change from current state to ideal state. Whether in a physical disease or a psychological condition, we are doing the same thing. Help a person to change from the current state to ideal state. So a person will ready to change from the current state to ideal state only if current state is not rewarding. If current state is rewarding, why should a person go to a ideal state? For example, will a Japanese sumo wrestler will come to reduce obesity to you? No,
No, sir.
because excess weight is a resourceful way, is rewarding for him. Same way, if his current state of sitting at home and not working is rewarding, I'm not asking financially rewarding, is in his comforting, then how we can make him to change? That's one thing. Second, do he need to change, or his wife or his husband or his mother or his children want him to change? The second question. We can never help a person to change if he's not intended to buy that change. The second thing. Third, what are the reasons for him or her to learn coding and not go to the work? Maybe he's not stimulated, not interested to do coding. He might be interested in doing something else. Second, he may not have the need to go and work because all his need are sitting in the couch. There are multiple things we look into. We have to look into what is his current state, and what are the rewards and resources which help him to continue in this current state. He is ready to get into an empowering state. That is the vision to get to ideal state, and then make a program to go there. Third, you have to look into the pattern. What are his pattern of in current state? Maybe he get up in the morning, You get a tea, you go and sit in the couch on the TV. When he started, I'm just saying as an imaginary thing, if on the TV, he may not be able to get down from the table, this couch and go to work. Some cases, even simply disconnecting the cable network internet make people to go to work because a pattern in disruption may work. I had a patient have a problem of drinking alcohol every day, but he don't drink alcohol after dinner. I asked him to have dinner every day at 6 o'clock because his pattern was having alcohol at 9 o'clock after dinner at 8:30. He's not a person who like to have alcohol at 7. Having 6:30 dinner, he is simply able to overcome the habit of having alcohol because the pattern is interrupted. So we have to look different ways of handling it. There is no straight answer which work for that. We know in naturopathy, we know there is one treatment which works for all. There is no one technique will work for all because every person is individually unique. Every person disease and condition is individually unique. You have to make a tools accordingly for that. But we can help them.
We
Okay,
have
sir.
another.
Thank you.
How to bring a person to semi-hypnotic state, which brings a person to do some work.
How to remove childhood trauma, how to bring up a person to do some work. Again, the clean language method, I start first. What doing that some work? What is that sub? What is that work? These are very generalized statements. Do you want to do the work which you like, or do you want him to do the work which he like? Do you want the work which you rewarding for you or rewarding for him? Do you want the work which is he has skill, or do you want the work which is qualified? Only we can answer such questions. A person make a person to do some work is making a work which is rewarding for him, which is interesting for him. We can change people, motivate people only based of three things. Not love. Love don't come to in the prison of love. We can change people only for three reasons. One, fear. If you don't go for work, you don't get food. People go work. Benefit. If you go for work, you get salary, you get money, you get reward, you get recognition, you get power. Third, ideology. Ideology is the strongest tool. If you came that you being a human, you are a spiritual person, you have to invest your energy, multiple things can invest by counseling and other ways to motivate ideology. People are ready to die and kill each other motivated by ideology. If you have the skill to incorporate that in the person, a person to do some work is incorporating using these two tools, using various techniques or technologies tools which I said earlier.
Thank you so much. So I think with this, we come to the end of today's workshop. It's time for the vote of thanks. And I really feel that the workshop had been very meaningful throughout this 1 hour of 15 minutes, 17 minutes, what we had spent. So what I feel is we have such a knowledgeable and resourceful persons with us, doctors with us. I'm feeling that the community should know them, connect to them, and get their practice, their learning in a very proper way. So I think Dr. Srijit, we have already uh, had an earlier comment. Looking forward for the fellowship. Thank you so much, Dr. Srijit, for the new insights, especially for the inner child healing. So I think you should immediately think about starting your fellowship program. So heartful gratitude to you, sir, for delivering such a insightful, deeply meaningful session today. And your clarity, scientific approach, and the compassionate words enriched every participant. I think all the doctors and students are really benefited with your session. Your profound understanding of the topic of the inner child healing. This was a very new word what I listened today, and it's going to help us in our practice. We appreciate your time, your dedication, and the depth of knowledge. And thanks to all the participants who took time to attend this session. And yes, we are looking forward for more such sessions so that we can actually make our system stronger, and really our community should grow, our individual capacity should increase, our individual efficiency should increase, and these workshops are meant to do so. So thank you so much, one and all, and especially to Dr. Sujit for his wonderful time. We really owe you for your such a depthful knowledge, and I'm really thankful to you from bottom of my heart. Thank you so much.
Thank you for the listening and active participation, and hats off, Dr. Vivek, for this continuous effort.
Thank you, sir. Thank you so much.